Good morning, 9 o'clock Eastern Standard Time, coming to you live from Harper's Ferry, West Virginia, 60 miles up the Potomac River from our nation's capital. And glad that you're joining us this morning before we get started with a very exciting day where we feature up and coming companies that have that are targeting healthy longevity in some manner. I'm here, of course, with Thomas, who you well know, but we're joined by Pepper Landson, who is going to chair our session today. And great to have you, Pepper. I love what you're doing at Praetego, and I love that name. Tell us about what you're doing and what the name means.
Sure. So Praetego is named in Latin, and it simply means to protect. And that is the mission that we are on. We're developing novel small molecules that target neurodegenerative diseases associated with aging. So
it truly is a meta-obesity approach, and protect is really a good word. We're not kidding ourselves that we're going to completely prevent the risk of chronic diseases. We can only protect or reduce the risk against developing diabetes or neurodegenerative disease. So that term is really very apt. And Thomas, I would say what we'll be talking about today is very largely companies that are protecting against one or another chronic disease.
Yes, we have an interesting lineup today because in the morning, we'll have some larger companies, or large in our space, in our young space. So 9 figures of capital deployed or post-money evaluations. We'll have the more emerging companies in the middle and later in the day, but they're all obviously part of what we used to call the meta-obesic companies, now the healthy longevity companies.
Yeah, so we'll have to get used to calling them healthy longevity companies, but I think that's a good term to use going forward. I did want to suggest that you continue to follow the efforts of the Catalyst Institute by joining the campus that we've talked about, and maybe you're hearing about it for the first time, but this is essentially a virtual resource where the community can come together for various purposes and for sharing documents and even starting one-click Zoom meetings. So we encourage you to sign up, and this will also be a way to access the recordings of the meeting of the sessions that we've had at this and other conferences. Thomas?
I think those will be available within a week. So everyone who registered for the conference will get an email notification when it's available. So please do check it out. I certainly need to rewatch these videos. It's like drinking through a fire hose this several days. So I look forward to going back and re-looking at the sessions.
Pepper, you actually have your original degree in communication. And so you have been helping us as well with communication. And boy, is that key. We're going to be working on that in the next conference.
Absolutely. Absolutely. Because ultimately, the folks we will be serving and are serving with the research we're doing are people who don't necessarily come from a scientific background. I was blessed with a very early experience in bringing science to the masses. I used to have to write consent forms for the US military for clinical trials. And it was a great opportunity to be able to explain.
And that is so key to our initiative, given that it is so multifaceted, so many stakeholders. It makes it very challenging to effectively message to every corner of the community. So thank you for that help and the ongoing help to be more effective at communicating. Now, yesterday, we had an amazing, epic 2.25-hour conference that everybody who is going to be present in this day should go back and look, because it's very relevant to what you're doing. It really is a beautiful discussion of the ecology of supporting what you're doing. And so don't dare miss that recording. And Thomas, congratulations on putting that epic session together.
Well, I guess I'm patting myself on the back a little bit. I don't know where else on the planet you could have gotten senior executives from Lilly, Novo Nordisk, Pfizer, PepsiCo, Mars, and other representatives of the biotech leaders as well in one room talking about all these different issues. So we absolutely recommend that you check them out. Can we ask if Dennis and Phil are in the house? Maybe they can join us.
Yeah, we'd love to have them come in. They were the master moderators. We had to have 3 moderators to pull this off. And they all were just superb and making this a very fluid, dynamic discussion that was so engaging, so rich in insights. It just kept coming.
Hey, Dennis.
There's Dennis. Good morning.
Hi, everybody.
Congratulations again. You really pulled off an amazing session yesterday.
Oh, you're too kind. You're too kind. Thomas pulled it all. Thomas pulled it all together.
Well, he did. He deserves great credit for that. But it took some virtuosic performance to make it what it was. And truly, Dennis, I'm highly recommending it to our audience today because it's very relevant to just what everybody is doing, whatever company they're in. This is a must see and hear for folks who are trying to make their way in a very complicated environment.
Phil,
Yeah.
shout out to London. How is London treating the industry?
Well, London's as international as everybody else is, and I've actually just come back from the US. It's been fascinating. I was at the Buck and at a few conferences and meetings with some people. The industry is obviously going through somewhat of a challenge in terms of the funding environment that we're all facing.
Yeah.
At the moment. Of course, the discovery work that's going on is quite incredible, and we're seeing it accelerate at a pace where more companies are now going into their clinical stage. We've got a lot of preclinical companies that are working in some very exciting spaces. Obviously, a lot of people are very focused on cellular reprogramming at the moment in the space, but that's not all that's happening. There's a lot of rejuvenation work going on across the board. And we've also found that diagnostics is one of those areas that's really getting a lot of interest now from people, because really this whole debate about metabolic age and standardizing metabolic age for the industry to be able to really truly identify aging as the driver for many of these metabolic diseases is going to be really, really important. And you'll be pleased to know I've been doing my slides for the various conferences I've been presenting at over these recent weeks, and we're heading off to Berlin this afternoon to present there. That
Wow.
actually, last year the sector grew double in terms of capital investment into longevity companies. So we've deeply analyzed 560 longevity companies.
Amazing.
Wow.
Yeah, and last year they raised $7.3 billion collectively.
Wow.
That was double what happened in 2020, and we're seeing, obviously, thanks to the contribution from Alsos to the 2022 numbers, which of course is a challenging year in some respects on many fronts. That actually that's seeing us to be on track for at least matching last year, and we expect to possibly just exceed that. So really we're seeing an awful lot of activity in the space. It's not London specific because, as you may be aware, we're very much an international business.
Sure.
But yeah, it's very exciting times for us all.
Can I ask a
Wow,
clarifying?
sure. Go right to
Phil, can I ask a clarifying question? Of that 560, is there a checklist you use to demonstrate these are longevity-oriented companies? Is there a protocol for
How
that?
would you find and include them on your list?
Yeah, absolutely. So really what we want is we want to ensure that they fit within one of 4 longevity categories. So I mentioned diagnostics, obviously, already. So Diagnostics is a really key part of that. Prevention is the next phase, where obviously we want to be in a position where really we're mitigating those aging drivers before they even happen. And we're obviously finding ourselves in a position where really that disease doesn't happen in the first place. Treatment, of course, is part of that as well. You know, we obviously have to be in a position where we are treating the diseases of aging should they occur. But of course, there are a lot of very exciting new therapies coming into the space on that at the moment. And then renewal. So we see that really renewal is a key part of the process. If the aging driver is taking effect, that actually we can renew the body before a treatment is going to be necessary. So
how would you size the pizza slices? I mean, they're not all co-equal, I assume. So
no, not in terms of actually how it's structured. I'm happy to quickly throw up a slide if that would be helpful for you.
Yeah, please.
Yeah, absolutely.
Yes, share your screen.
So
and Dennis, chime in here when you wish.
ask questions, whatever.
Yeah.
Yeah, so this is the way that we actually have mapped out longevity, as you can see here. Really in the middle, we've got aging drivers, determinants and diseases, which are really the sort of founding core of our
So
thinking.
could you put that in slideshow mode? Just to maximize
Yeah, sure. Not quite sure how to do
the one with
that.
the TV screen icon.
Or at least just reduce the page thumbnails to make the screen a little bit bigger.
Yeah, sure. My apologies. Yeah, so there we go. So that's how we look at it. And really what we've done is we've segmented the marketplace by those different categories. As you can see here, this is the cumulative investment into those 25 areas over the last 5 years. And you can see that reprogramming is very big. And it plateaus out at diagnostics before we then go into some of the longer tail items. But of course, those are in the longer tail because they're attracting less capital, but they might be more up to date in terms of their relevance to the longevity sector. So we can see, quite a lot of activity going on in the space. And the way we actually look at the domains is, as you can see here on this slide, this is how we break down those 25.
Wow. Phil, this is gold. We've got to get you to next year's conference, put you and Dennis Purcell and a few others in a room and work through this. It's just an amazing display of what's going on.
Yeah, it's very, I mean, the team's worked really during the course of this year on really getting us to the point where we're ready to share this. And really what we've been doing, as you probably are aware, we run a investment brokerage business where we really are looking for matchmaking investors to startups. So really what we've done is profiled a lot of investors as well. We have over 1,000 investors, VC, mainly deeply analyzed now. And what we're doing is understanding what their stage and their bite size appetite is, but likewise where they're focused. So really this has been a very important part of really helping us not only to define the size of the industry, but also really shape up how we introduce investors to the right types of companies.
Can you comment on any trends amongst the investors? I know that there's the overall bear market in life sciences, but would you say historically that it's exploding, growing, exploding, exponential? How would you characterize the investors looking at the space? And are they specialty? Are they more general? Are you bringing in more mainstream investors?
Well, definitely. I mean, the investors really that we have at the moment are, they're traditional biotech investors. You can see this slide here really shows you the figure I was referencing earlier, where of course you can see there's this massive jump between 2020 and 2021. And likewise, this big spike in company formations. So you can see that obviously the drop off there is what's happened as a result of not only COVID, but likewise some of the downturn in 2022. But as I see going forwards, we are talking with all mainstream investors. So these are not just longevity specific funds that that are participating in these deals, and likewise the ones that we're speaking to. So we're speaking to really all of the mainstream, the sort of Sandhill Road investors, as well as some of those really big names that we're all familiar with. And they're all very active and interested in the technology they're representing, they might not see it with a longevity lens as much as we do, but I can absolutely assure you that people understand longevity as a sector now. And the exciting thing that we've found is that the venture capital arms of the big pharma companies are also very engaged, not only in the deals that we're representing to them, but also in our readership as well. So we're seeing really that the sector is significantly growing. It is still 1/50th of the biotech and the fintech sector. So longevity has still got a long way to go before it starts to be, taking market share from some of those other big beasts in the investment landscape.
Well, let me just ask Dennis Purcell, the founder of, or one of the founders of the biotech industry, to comment. Do you think this is a successor, or at least in a way, does it look interesting like biotech looked to you in the early days?
I think so, but I think we're going to see different types of investors. And obviously in the short term here, we're in for a little bit of a bumpy ride. Even just this morning, we got some terrible inflation numbers.
Yeah.
And so, a few years ago, one of the things that caused the biotech boom, if you will, was this phenomenon called TINA. There is no alternative. Interest rates were zero, and you can put your money in put your money in biotech as good as anything. And today we have this situation where interest rates are starting to rise so rapidly that there is really an alternative. So in the short term, we have a little bit of a challenge. But I think there's couple things that are happening. One, and Phil started to allude to this, when we look at some of the deals that were done last year, you're starting to see more mainstream biotech investors move into the space for the first time in some size. So that's a positive. But I also think we started to see this in biotech. But my hunch is in the healthy longevity space, there's a whole pool of capital that's out there that is going to get interested in this if we develop the industry properly. And I'll just name kind of three things. Over the next few years, we're going to have this thing, the great wealth transfer from baby boomers to millennials. And for us baby boomers, we buy stocks and we buy bonds, but the baby boomers, they want to make an impact. They have different types of portfolios. And this transfer is the biggest in history. They look at crypto, they look at other things. I think longevity is right up our alley there. The second group that's different than the traditional investors are the family offices. They're intergenerational. They have a little bit more patience, if you will. They actually dwarf hedge funds.
Is that right?
Yes.
Wow.
There's about 4 trillion of hedge funds out there, and there's about 7 trillion of family offices.
Wow.
Dwarfs it. And they're as a traditional venture capitalist, I have a little bit of a problem in terms of I have to return capital to our limiteds in a relatively short period of time, because our limiteds, like people like state of California and the like, they have pension obligations to their retirees, and so they don't have the luxury of waiting around for a longer period of time. These family offices are intergenerational, so I think we have it's more patient capital. So you take the wealth transfer to the baby boomers who want to make investments in stuff that matters. They don't really want to do. They're not going to be investing in coal and stuff like that. They're going to be investing in things like we're doing, in the family offices. And then lastly, there's this huge movement toward ESG, environmental, social, and governance issues, and that has exploded. And we're kind of right up that alley. I mean, we're doing something that's really positive for society. And so many of these funds now, their mandate is to invest in this type of enterprise. So I think it's really interesting, the numbers that Phil put up, and I'm encouraged by the fact that some of my mainstream peers are investing in the sector. But I think there's an enormous amount of capital out there that's really ripe to invest in the sector if we develop the sector properly, which means we can't overhype it and we can't overpromise it. I mean, one of the things that people have gotten kind of soured on in life sciences is that we got way ahead of ourselves in 18 and 19, where, you know, people, you know, you had one mouse treated for cancer and you were worth $1 billion. I mean, those days we need a correction. And as I say, over the short term, it's going to be a little bit difficult just because of the environment that we're in and some of the options that we have with interest. You know, when you can make an investment and get a coupon that pays you something today in cash, you don't quite have the same appetite to wait for 5 years or 7 years. You'd rather just get it today. So it makes the cost of capital a little bit higher. But boy, there's a lot out there, and the signs are pretty good. We just have to develop the industry properly and not get ahead of ourselves. So one of the things you talked about at the beginning of biotech is that after Genentech went public and biotech came on the scene, you know, for the next 5, 6, 7 years, all these companies were formed, and they were really science projects.
Yeah,
and that set the industry back a bit, because they weren't really companies. So I think one of the things we have to do here, and one of the things that I was encouraged about yesterday was some of the business models that we talked about, the stepping stone business model. You do this for and the like. So I think that we have to continue to hone our message about our business model. And if we do, we're sitting at a great place with a lot of capital that is really right for this industry. So I'm kind of long-term bullish. This morning, after listening to CNBC, I'm short-term bearish.
This should be
this morning
on CNBC. This is just gold between you and Phil. It's just an amazing analysis. I'm astounded. I totally dumbfounded that I just didn't understand this. Yeah, please, Pepper.
Dennis, I really appreciate your framing of this rather early section of biotech and it being in need of stewardship, right? Because the hype will set us back, but hype is human nature. We sometimes just get exuberant and get ourselves into trouble. And scientists and clinicians are no exception to that human psychology rule. So when I think about the lineup that we've curated today, one of the questions I'd love to see answered is, how is the work that you're doing and the way you're messaging it acting as a steward to this space? Because that's just as important to create and curate thoughtful investment over the long haul. And I love your phrase of patient capital, because that has sort of a double entendre, if you will.
Yeah, beautifully summarized.
A steward of the space and a steward of the capital that people have entrusted to.
Yeah,
absolutely.
absolutely.
One of the things that I've felt over the years very, very, deeply was that people entrusted me with capital. And I had to really take care of that very carefully. And a little bit in biotech, we let that get away from us a little bit at times. I mean, we're going to correct now, and we're in the process of correcting, and we'll get on to the next stage after this. If we can avoid, Pepper, like you say, some of that hype, I think, the healthy longevity industry is going to move forward a lot faster.
Phil, what is your view as to hearing some of the context of the early days of biotech in the 80s and 90s, and how are you seeing similarities and maybe possible points of distinction as you survey the longevity space?
Well, where we're at the moment is really not many companies are in clinical, and those that are really haven't proven out where they are. So I think that we need to keep our optimism, but base it in reality. Yeah. And I do think that really, in terms of the industry, its rhetoric has definitely changed over the last 4 to 5 years. I think people are grounding their what they say in the science, and obviously the capital's coming in to support that. I think people are talking less now of living to 1,000 and more talking about living healthily till 100. And I think that that's really healthy. And I think that really what we need to do is we just need to prove out what a lot of these companies are doing now by getting further through the clinical pipeline and obviously proving the efficacy of what they intend to do. Now, of course, all of those are going to still be focused on a disease endpoint at this stage. And that's a challenge really for investors that have an appetite for longevity. And I know that I'm sure our speaker will be able to help us out on this, because of course Cambridge's model is to invest in disease first and then widen out later. And we see that a lot in the propositions that we're dealing with at the moment. So of course there is a commercialization pathway, which is great, and that will then give returns to those investors. So we are really in an existential kind of position at the moment of just really making sure that we're grounding the plans that we're seeing and the funding that's going in the very traditional biotech model. But of course, the opportunity there is to open up these aging drivers and really prove where we are in terms of managing our age and our health better. And again, that's really going to come back to what I referred to earlier, which is the clocks that are in the industry now to really help us understand, can they be accurate predictors of age?
Can I ask a question about that? I'm curious, what is the commercial model for all of these diagnostics and clock companies? I mean, I understand if they're able to monetize by selling direct to consumer in some sort of based on information people want, et cetera. But at the end of, I understand products, therapeutic products and preventive products, how you spend money to buy them up. What are you seeing in the business models for the diagnostics?
Well, their model is a repeat model. So when you've discovered that you're either younger than your
razor blades, right?
Yeah, if you're younger than your chronological age, you want to hang on to it, and if you're older than your chronological age, you want to reduce it. So the only way you can track that is to continually test and repeat. So there's a very strong subscription model there for these organizations. And of course, they need to really be working very closely with the product manufacturers, because really those product manufacturers, whether they're supplements or ultimately going to be therapeutics, their goal is to demonstrate their efficacy. And really that comes through really having a very stable infrastructure to the diagnostics and the common standards really around the clocks that they're based on. So obviously there's Horvath, but there are others. And for me, that's really something that's very interesting for the sector overall, is to come up with a common standard for, first of all, assessing age, metabolic age, and then likewise tracking it going forward, and obviously ultimately tracking it to a death endpoint, or being able to predict that death endpoint, so that we can really understand that these clocks are accurate in the scale of human lifetime.
And well, to that point, Phil, as you know, we're going to ultimately need treatments that can actually validate the biomarker or the clock. So it's a very intertwined relationship that is, in a way, very challenging to achieve. It's
you need the clocks for the therapeutics, and you need the therapeutics for the clocks.
So we're building it while we fly it, and it's quite a proposition.
Okay.
But
Can I just
go ahead, Dennis. Take the last word here. We got 1 minute.
Okay. Given what we just said and about the models and the development of the models, what Pepper said about this, the stewardship of the capital, the patients, the non-hyping it, I think one of the things we have to focus on is really developing good talent to run these companies, people that are good stewards, to run it, to be on boards and things like that, because that's going to make all the difference. So as we develop this and as we fly and we're making it up, quote unquote, as we go a little bit, good solid leadership across the board is going to become really important. And I think we have to really focus on that and help people to develop. And that's going to help the industry immeasurably going forward.
Wonderful way to bring our discussion to a close. Thank you, Dennis and Phil. I'm going to duck out of the way, and we're going to get started with some exciting companies.
Thanks, guys.
All right, super.
I guess she needs.
You're leaving me all by myself in here. Great. Well, good morning, gentlemen. So Phil and Dennis, it might be wise to take maybe 30 to 60 seconds each. Both of you bring great wisdom to this space. And certainly as we start with the larger cap companies who've been in the space the longest and are leading the reputation as well as the effort, I would love for you to offer your perspective very quickly, as well as what you'd like to see us as an industry or a breaking industry offer, over the next maybe 1 to 2 years, even with the financial constraints being what they are. Dennis, why don't you go first?
I think that unlike the biotech industry, which was kind of easy to describe, the healthy longevity industry is a little bit amorphous, and I think that to the extent that we can kind of describe a little bit, narrow down, not even narrow down is the wrong word, but kind of define a little bit what we're talking about, even like what Phil said with the 560 companies and the investors. If we can kind of put a kind of box around a little bit, exactly what is healthy longevity and what does a healthy longevity company do? And in that context, what does a model look like? And I think with looking at Mark there, I mean, Cambrian is like a perfect example, the best example out there almost. If we could use more of those, because then it becomes very, I'll just stop in a second, because it's easy to say, I have a phase 2 compound that's going after pancreatic cancer.
Absolutely.
I understand. I understand how many people have pancreatic cancer. I can ask what the mechanism is. I can figure it out, and off we go. This is a little bit tougher. So I think we have how we define ourselves would be something I would love to see us develop a little bit more.
Well, thank you. I appreciate